Nonprofit Conversations, brought to you by Rogue Tulips Consulting. Welcome to episode 172. It's Monday, November 7th, 2022, and I'm your host, Cecilia Sepp. Today we're talking with Kimberly Stansell, a meetings and event expert, about healthcare meetings. Are they really different? Hey everybody, it's Monday, November 7th, and that means it's time for another episode of Nonprofit Conversations. I'm your host, Cecilia Sepp. I'm a certified association executive, and I am the principal and founder of Rogue Tulips Consulting. Thanks for joining us this week. And to our global audience, I would like to say good morning, good afternoon, or good evening, wherever you may be. We're really excited to have one of our favorite guests return, Kimberly Stansell, who is a meetings expert. And today we're going to talk about healthcare meetings. Are they different? Welcome back, Kimberly. Would you like to say hello to our audience and tell us a little about yourself?
Thank you, Cecilia. It's wonderful to be back, and I really appreciate this opportunity to connect with your audience again. I'm Kimberly Stansell, and I am a meetings and events strategist based in Southern California. And I partner with organizations in the healthcare, technology, and pharmaceutical sector. I consult with them on how to produce meetings, conferences, and special events.
Oh, that's great. And I'm so glad you're back. We had not had the opportunity to talk since September. So when all the weather was so crazy. So it's good to have you here.
Thank
you. You're welcome. And a lot of people may not know this about my experience, but I've worked with a lot of healthcare clients. So whether it's an association or a foundation. Mm-hmm. And I also used to work at a healthcare association for otolaryngologists, which are ear, nose, and throat surgeons. So I say ear, nose, and throat surgeons. They are all trained to be surgeons, but they're ear, nose, and throat specialists. So if you have an ENT, I used to work with those guys and they're great. So I have a little bit of experience with that. I also have done a lot of healthcare policy in the past. So I'm always interested to talk about this segment. So I think the first question we want to talk about, Kimberly, is this: are healthcare meetings really different from other meetings?
Yes, they are, because a healthcare meeting is a gathering where physicians, scientists, and other practitioners come together to learn and hear about healthcare information, such as case studies, research, emerging technologies, and to get recommendations on techniques and practices. So they're unique in that way. And additionally, there's a CME component to those meetings, because healthcare professionals do need the CME hours to keep their credentials current.
I think that's a great summary of what's different about healthcare meetings and their different needs for their audience. Mm-hmm. One of the things I always wonder about with healthcare meetings, are there a lot of hands-on technical training at the meetings that you help people with?
Like it depends. Well, it depends. Like you were sharing in the opening, the group, the specialty that you worked within. So the format of a healthcare meeting or conference will be dictated by the specialty. Like, who is the target audience? Is this is a meeting for a group of oncologists? Is it for internal medicine individuals? So it just depends. And that's what dictates the content and the format and the agenda for the meeting. And sometimes it will be hands-on, sometimes it'll be lecture, and sometimes it will be a combination thereof.
And I think that is really a different thing about healthcare meetings, is that hands-on training. Because, for example, like what you and I do, you're a CMP, I'm a CAE. We don't get hands-on training at our meetings. Usually we get a lecture with maybe some activity, but we're not actually typing or practicing something the way healthcare people might. And what are you seeing now that the world has started edging back to in-person events? In some parts of the world, people are just fully back into the swing of life, going to the office, going out to eat, going to visit friends. But at a healthcare meeting, do you see a higher level of awareness for things like virus transmission or germs?
Well, that's a great question. We are meeting again. Healthcare meetings are happening. Attendance is positive. It's pretty robust. But one thing that I've noticed in terms of health and safety protocols, some healthcare meetings, their protocols are based exclusively on the state and the local municipality or local ordinance where the meeting is being hosted. And sometimes the guidelines are stringent, sometimes they're a lot looser, but it depends on where the meeting is held. As a general rule, a lot of those touch points that we had throughout the pandemic and through the height of the pandemic are still in place, but a lot of those touch points are optional, like such as masking, sometimes vaccination requirements. That varies from meeting to meeting. So it just depends. And I think that the attendance is dictated by how comfortable and how safe an attendee may feel to participate in a particular meeting.
Well, do you see healthcare associations imposing their own rules and stricter guidelines? Like maybe they say if you want to come to our meeting, you need to wear a mask?
In 2022, the meetings that I've produced, I had one that their guidelines were pretty stringent, and it was because of where the meeting was. But this month, I've had two meetings, and one of them, the guidelines were loose. They were pretty relaxed because that's the location where the meeting was being hosted. The guidelines and the requirements were loose. And then the second meeting, there were no health and safety protocols in place.
Really? None?
None. And
Wow.
I was shocked because on the registration website, they had a section and they said, we will do everything that we're required to do to make this meeting safe. And so it was pretty vague language. And I always do a know before you go document for our exhibit teams. Mm-hmm. So I reached out to the planning team of this conference and I said, oh, is this your COVID policy, your pandemic policy? And they said, yes. And this was like 2 weeks before the event. And they said, we're doing what we're required to do in this particular city. And they weren't required to do much. Mm-hmm. So it was pretty optional. Yeah. Well, see, whereas before, in the height of the pandemic, when people were starting to meet again in person, people would, they'd know in advance about you had to have your vaccination status, masking. A lot of that has relaxed. And when I have participated in a lot of my monthly planner meetings with other medical meeting planners, that's what everyone is reporting, that sometimes you go to meetings and it's like the pandemic never existed. And then sometimes you go to other meetings and the requirements are there. So it's all over the map. I think that what could happen as we get into the colder months, and if there are any new variants that crop up, then collectively, as an industry, we will have to regroup and be agile and go back to some of those good practices. But it's very mixed. That's a very accurate assessment. It's mixed on what's being required.
That is so interesting.
Yeah.
I live in Maryland, and even Maryland by the summer of this year was fairly relaxed. We didn't have to wear a mask anymore. People weren't necessarily requiring vaccine cards to show that you had actually been vaccinated. And Maryland's actually pretty strict. So that's really interesting to hear that about the different places. Some are still strict and some are not. But when you're looking at that, do you think that it also is influenced by what specialty the meeting is? So, for example, if it's like virologist versus surgeons, like do you think virologists have a more heightened awareness and concern about wearing a mask?
I think that could be true. I'm thinking about the meeting earlier this year where the guidelines were pretty strict in that particular sector. I think that could be very true. But the main thing I'd like to stress about health and safety protocols is wherever it is and whatever the specialty of the conference is geared towards, people have to feel comfortable being able to have their own protocols in place. So we have to be tolerant and respectful of each other. So if someone chooses to mask for whatever reasons, that person should not be made to feel that they're doing something odd or unusual. So we have to be able to commingle and interact in a very respectful way. And if someone wants space or distance, then we have to all respect that. And I think that you see that at meetings as well. So even at the meetings where the health and safety protocols are more relaxed and people choose to mask or wear gloves or maybe have a wristband that says no hugging, people are responding to that and being respectful of that. So again, just because is not a stringent policy in place or in force, there are people who are still showing up to these meetings with their own health and safety protocols in place for themselves as individuals.
And I'm so glad you said that, Kimberly, because I think that's really important. We all have to do what makes us comfortable in protecting our own health. And even before we had a COVID pandemic and the lockdown and the rules about managing the spread of that, I used to travel quite a bit and I saw people wearing masks all the time, especially people who were traveling from one country to another country, because they knew they're going to be exposed to things they haven't been around for a while or have never been around. So I think honoring that, what makes people comfortable, is really important. And it's made me sad all year hearing people tell me there were times where they were still wearing a mask and people made them feel uncomfortable for wearing a mask. But again, people have to take care of their own health. I'm pretty much hey, if you're wearing a mask, good for you. I'm not necessarily going to because that's just my choice. But when it was required, I did do it because, we all have to try to help each other get through these things, right?
Yes.
So I think that's a sad outcome of people being tired of wearing masks and then wanting to throw them off, is that the people who were probably already wearing a mask before that you just didn't pay that much attention to are now we're getting the stink eye. But an interesting thing about giving people space, and I would love to hear, like, if you do this or recommend this to your clients. So way back in August, I went to the ASA annual conference in Nashville. And it was a lot of fun. It was the first in-person meeting since 2019. So everybody was like really excited to just be in rooms with other people again that were not Zoom rooms. But one of the things they did that I thought was just an excellent idea is you could pick the color lanyard you wanted. So green meant you were open to touch me, hug me. I'm fine with that. Yellow meant, well, maybe ask me first. And red is like, absolutely not. Stay away from me. And what was really interesting is they ran out of green lanyards.
Oh, wow.
Was just really, and then I started to shake someone's hand who was wearing a yellow one. I didn't notice it right away. And I started to put my hand out and I pulled it back. And I said, I'm sorry, I just noticed you have a yellow lanyard. And she just kind of laughed and said, no, it's okay at this point. I'll shake hands because I've been around all these people. So are you seeing that as well in the healthcare meetings? Are people wearing different color lanyards?
I don't see those tools in place. I haven't seen a lot of that in 2022. I know personally, I still mask. That's a personal preference. I don't shake hands. That's a personal preference. And I've learned how to present myself in a way when I have that face-to-face contact, whether it be with a stakeholder or a colleague or someone that I don't know. I've just learned how to present myself so that I'm not uncomfortable. And I'm signaling to the person that this is what I do and I don't do. And so I haven't had any problems with it. I did really like when there were the different colored lanyards or wristbands or the badge sleeves that indicated, what a person's preference was. And again, it just comes back to people doing what makes them feel safe and comfortable, because people love to meet in person. And that is one of the number one drivers of why we have medical meetings. People love that face-to-face communication and those networking opportunities. And you don't always get that through a virtual meeting or an event that has a hybrid component. It just doesn't translate the same. And when you meet in person, there's opportunities for this like impromptu collaboration. And you just don't get that over the internet or through a virtual setting. So it's still evolving. We're still growing. I think all sectors of the meetings and events industry is still evolving and still growing. And we'll have a soft landing, but it's really important that we all be respectful of just people's preferences and continue just to meet in person. Or if someone, the hybrid option sometimes makes a lot of sense for societies and organizations to add that onto an in-person meeting. And then sometimes it doesn't, because having a virtual component or having a hybrid meeting, that's like planning 2 meetings in one. So, and that can be costly. So, we've just got to be good neighbors, good citizens, and just be respectful of each other, because people do love to meet in person.
And I think that's excellent advice about just respecting each other. And your choice to not shake hands is a good one, because another thing a lot of people don't know is I used to work in a hospital. It's how I worked my way through college. And so I was around patients and sick people all the time, and the occasional dead body, but that's another story.
Yeah.
But fortunately, they don't tend to want to shake hands, so you don't have to worry about that. But I did learn from working in the hospital, the best way not to catch something is don't touch people.
Yeah.
And because even if you aren't wearing a mask, if you don't touch someone, you have a lower chance of catching something.
Yeah.
Just shaking someone's hand or helping them in and out of a wheelchair, you could catch something, whether it's a common cold or something worse. Fortunately, I was lucky. I never caught anything at the hospital. Well, some grief from my supervisor, but that's even another story. So, well, Kimberly, what else have you seen that's a little different about healthcare meetings than maybe you might see at let's say a meeting for attorneys?
Well, what would be the difference? Well, their purpose for being there.
Okay.
That particular sector, their drivers may be something else. So for example, with healthcare meetings, it's content, it's accessibility, it's the opportunity to network and learn about new things, get recommendations on new techniques and procedures. So those are the drivers why people attend healthcare meetings. So a group of attorneys, their drivers may be different. And so that's what will make the meeting different, because based on those drivers, then the conference producers, the meeting producers, they will develop a curriculum and an agenda that meets those attendees' needs.
Well, and I think that's an excellent point. It's who's coming and what do they need.
Yeah.
And I think I thought this was an interesting topic to explore when it was suggested, solely because I think a lot of us who are not in healthcare think it's really, really different. But healthcare meetings, they still want to have receptions. They still want to have the coffee breaks. They still want that opportunity to sit down and eat together and talk. And I think with what healthcare professionals do, they have to be present in order to do their job. So whether you're a nurse or a doctor or an X-ray technician, you actually have to be there with the person in order to do what you do. And so I think that's another element of the healthcare community that's a little different. An attorney can help you over the phone or help you much easier over Zoom than a doctor can. Although I think telehealth's a great idea, but they really probably want to take your temperature and feel your pulse themselves. So I think that's a really good point. And as we're actually near the end of our episode already, believe it or not.
Oh, wow.
It's always fun to talk to you. I will definitely invite you back because we want to get ahead for 2023. What are we looking at? Are people still going to be getting together? And you always have some great insights for us. So as we're wrapping up, Kimberly, as you know, being a returning guest, we like to ask, what is your takeaway that you would like the audience to leave with after listening to this episode? And then if they wanted to get in touch with you, what's the best way to contact you?
Well, as a producer and a strategist for healthcare meetings, it's very important to stay on top of trends, what's going on in other sectors of a certain specialty. So pay attention to that. Be prepared to advise clients and your clients, your stakeholders, with some real life examples, with trends that you're seeing happening, so that they can craft together a really robust agenda for their conference attendees. So that's the main thing. Participate in different groups with other meeting planners, other medical meeting planners, other event strategists, to find out what they're doing in the field, what they're seeing. Like, for example, I participate the second Tuesday of every month through PCMA. We have a online group that meets, that are all just medical meeting professionals. And I've learned so much from them. We share, you get to actually hear what's going on in the field. And so that's the value add as a professional you bring to your stakeholder group. And then for those who want to get in contact with me, they can reach out to me through LinkedIn.
Oh, that's great. Well, thank you, Kimberly. That is a great closing thought. And I really like your suggestion of finding that niche networking group to elevate your own performance. So that's wonderful. Well, we have to go rogue for now, but we'll be back next time with another exciting episode of Nonprofit Conversations. I want to thank my guest, Kimberly Stansell, meeting expert and strategist. So do reach out to Kimberly if you have questions about planning your next meeting. And if you want to learn more about Rogue Tulips Consulting and how we can help your organization think outside the box and bloom outside the box, check out our website, roguetulips.com. We also offer an education program for current CAEs and CAE candidates to help you either maintain your renewal credits or get ready for that CAE exam. You can check out our education program at the501cleague.net. So that's all for now. On behalf of myself and Kimberly, thanks for joining us, and we'll be back next time.